Hello student. Today topic of lecture, the blood vessel system. Next question of lecture. First, structure of the blood vessels, types of the blood vessels, types of arteries, the vessels of pulmonary circulation, the arteries of systemic circulation, branches of aorta, branches of subclavian artery. Blood vessel system. Blood is transported in a tube system made of blood vessels. The blood vessel system occurs microscopically in a tubular network of arteries and veins, which is deeply distributed throughout the body. The naming of blood flow in relation to heart. The arteries transport blood from the heart to the periphery of the body or the lungs, and veins transport blood from periphery of the body back to the heart. All arteries carry oxygen-rich blood. All veins carry oxygen-poor blood. It isn't correct for the pulmonary circuit, whose arteries carry oxygen-poor blood to the lung for oxygenation. What you see picture two system, arterial system and arterial part of systemic system. This is vein part of systemic system of blood circulation. This is artery, heart. This is vein. This is heart. Structure of the blood vessels. In this respect, arteries and veins principally have the same structure. The wall of larger vessels consists from the inside to the outside of three layers. First lies tunica intima. This flat tunica intima. This flat endothelial cell layer is separated from internal elastic membrane by a basal membrane. The form is substantially stronger in arteries than vein. Tunica media, Latin. A layer of coat of smooth muscle cells, which in the case of arteries are the elastic type, containing strong network of elastic fiber. The smooth muscle cells regulate the vessel's cross-section by contraction and thus the resistant to flow. This is joined on the outside to the external elastic membrane. But external elastic membrane in vein is absent. This is external elastic membrane. Tunica adventitia. Tunica externa, outer layer. It contains collagenous connective tissue, which incorporate and anchors the blood vessels, with your artery vein, in the surrounding nerves, and in the case of vessels with a large diameter. Blood vessels run here for the blood supply of the vessels. It is vasa vasorum. What you see is located in tunica adventitia, vasa vasorum. Artery, vein, artery, vein. The passage of blood through the arteries proceed from elastic artery. What you see? Elastic artery, wall of elastic artery, aorta, for example. Elastic arteries is largest arteries near the heart, the aorta, and it mature branches, diameter ranging from 2.5 centimeter to 1 centimeter. Their large lumen allows them to serve as conduits for conduction blood between the heart and the medium-sized muscular arteries. More elastin occur in the wall of these arteries than is any other type of vessels, and the sheet of elastic in the tunica media are remarkably thick. The high elastin content of conduction arteries dampens the surges of blood pressure resulting from the rhythmic contraction of the heart. What you see artery, this is it is a wall of elastic artery. This is, you see, tunica interna, tunica media, tunica externa, elastic artery. what you see elastic artery, it is aortic, aorta, and pulmonary trunk. What do you see? This is coronary arteries. Coronary arteries. This is muscles type. Muscular artery. Muscular artery lie distal to the elastic arteries and supply group of organ. And parts of organ. They range in diameter from about 1 centimeter to 0.3 millimeter. They are called muscular because the tunica media is thick relative to the size of the lumen than that of any other type of vessels. By actively changing the diameter of the artery, this muscular layer regulates the amount of blood flowing to the organ supplied according to the specific needs of that organ. What you see, muscular artery, wall of muscular artery. This is lumen, this is tunica interna, tunica media, tunica externa. Tunica media has many smooth muscle. This is it is muscular artery. For example, arteria axillaris, arteria subclavian. Note you see muscular artery. This is radial artery, and ulnar artery, blood. This is red color. This is white color. It is nerve. This is muscles. This is artery of muscular type. Next part of artery. Arterioles are the smallest arteries with diameters ranging from about 0.3 millimeter to 10 micrometer. Their tunica media contain only one or two layers of smooth muscle cells. Larger arterioles have all three tunics plus of internal elastic network in the tunica intima. Smaller arterioles which let into the capillary beds are little more than a single layer of smooth muscle cells. Spiraling around an underlying endothelium. What do you see? Lumen. This is endothelium and tunica media, tunica externa. It is small arteriola. Next section, capillaries. What you see? Red blood cells passing through a capillary. Capillaries are the smallest blood vessels with a diameter of the 8-10 micrometer. Just large enough to enable erythrocytes to pass through in single file. They are composed of only a single layer of endothelial and endothelial cell surrounded by basement membrane. They are body's most important blood vessels because they renew and refresh the surrounded tissue fluid with which all body cells are in contact. Capillaries deliver to these fluids the oxygen and nutrients cells need, and they remove the carbon dioxide and nitrogenous gases that cell deposit into the fluid. This is fluid change between blood in capillaries, between extracellular tissue, extracellular matrix of tissue. Capillary form beds. What you see form beds. Capillaries supply body tissue through structure called capillary beds. A capillary bed is a network of the body's smallest vessels. Capillary beds run through almost all tissues, especially the loose connective tissue. Abdominal arteriole leads to meta-arteriole. What do you see? Meta-arteriole. A vessel that is structurally intermediate between the arteriole and capillary, from which branch through capillaries. The meta-arteriole continues into thoroughfare channel. The meta-arteriole continues into thoroughfare channel. A vessel's structurally intermediate between a capillary and venue. True capillaries merge into thoroughfare channel, which then joined a venue. Smooth muscle cells called precapillary sphincter wrap around the root of the true capillary, where it leaves the meta-arteriole. This is capillaries, this is meta-arteriole. What this is, you see, precapillary sphincter. The precapillary sphincter regulates the flow of blood to the tissue according to the tissue's need for oxygen and nutrients. When the tissue is functionally active, sphincter are relaxed, enable blood to flow through the wide open capillaries and supplies the surround tissue cells. When the tissue has large demands, the precapillary sphincter contract, closing off the true capillaries and forcing blood to the flow strange from the meta-arteriole into the thoracic channel and venue. Thereby bypassing the true capillaries. Their true capillaries. Each this way, capillary beds precisely control the amount of blood supply tissue at any time. Even thought most tissue and organs have a rich capillary supply, don't all do. Tendons and ligament, they polyvascularized. Epithelia and cartilage contain no capillaries. Instead, they receive nutrients indirectly via diffusion from nearby vascularized connective tissue. The cornea and the lens have not capillary supply at all and are nourished by other sources. This you see the capillary bed. This is bypassing. This is sphincter closed, blood flow through meta-arteriole, thoracic channel, and bypasses through capillaries. Sphincter open. Open blood flows through true capillaries. Then thoracic channel and venue. This is sphincter open, sphincter closed. Sphincter closed. Veins transport blood from the they run parallel to corresponding arteries. Overall, the cause of vein is much more versatile than that arteries and can show great individual variation. However, the large vein stems occur regularly in all people. Veins together with capillaries and venues belong to the low pressure system of the blood circulation. Since in the upright position, most veins have to transport the blood to the heart against gravity. The large vein of the extremities and the lower neck region have venous valves which support the venous return flow. They ensure that the blood flow is only possible in the direction of the heart. you see? You see accompanying vein. What you see? The artery, middle colic artery. Middle colic artery. This is arteriole. This is capillaris. This is vein. Vein. For example, portal vein, superior mesenteric vein. This is artery. Superior mesenteric artery. Superior mesenteric vein. Superior mesenteric artery. Accompanying vein, artery. The arteries are classified according to the wall thickness into the following types: large arteries, medium arteries, small arteries. Next, the arteries are classified depending on the blood supply to the body wall or organ into the following types: parietal arteries, visceral arteries. The arteries are classified depending on the localization of the organ into the following types: extraorganic arteries, intraorganic arteries. Next, the arteries are classified according from the name of the organ into the following types: splenic arteries, hepatic arteria. Next type, the arteria are classified depending on the level of divergence into the following type: lava mesenteric artery, superior mesenteric artery. Lava superior. The arteries are classified depending on the depth of the location into the following types: shallow arteries, deep arteries. This lava superior, shallow, deep, and other. Lateral branches of the single trunk or branches of different trunk can join one another. Such a junction of vessels before their division into capillaries is called an anastomosis. 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 Most arteries form anastomosis. Arteries which don't anastomose with newborn trunks before they transform into capillaries are called end arteries. End arteries are more susceptible to thrombosis, the formation of blood clots, to infarction, the local necrosis of an organ. What you see, right gastric arteria. This is left gastric arteria. It is anastomosis between arterias. What you see, right gastro-omental arteria. Left gastro-omental arteria. This is, you see, splenic artery. This is anastomosis between right gastro-omental arteria and left gastro-omental arteria. This is forms anastomosis. the vessels of pulmonary circulation. The pulmonary circulation begins of oxygen poor blood levels the right ventricle of heart via the pulmonary tract. This large artery exits the ventricle anterior to the aorta, ascending to aorta's left, and reaches the concavity of aortic arch, where it branches at a T-shaped divergence into right and left pulmonary arteries. Each pulmonary arteries penetrate the medial surface of lung and then divides into several lobar arteries, serving the lobes of the lung, 3 in right lung and 2 in left lung artery. The pulmonary trunk is covered with layer of pericardium up to its dividing point. Within lung, the arteries branch along with the lung's air passageway, bronchi. As branching arteries decrease in size, they become arterioles, and finally the pulmonary capillaries that surrounded the delicate air sacs, lung alveoli. Gas exchange occurs across these capillaries, and the newly oxygenated blood enters venous and then progressively large vein. The largest vein, tributary, forms the superior and inferior pulmonary vein at a red color, which exit the medial aspect of each lung in the mediastinum posterior to the heart. The 4 pulmonary veins, 4 pulmonary veins run horizontally just inferior to the pulmonary arteries and empty into left atrium of heart. This is left atrium. Vein, pulmonary vein 4. 1, 2, 3, 4. 4. The arteries and veins of pulmonary circuit have thinner wall than do systemic vessels or comparable diameter, reflecting the fact that maximum arterial pressure in pulmonary circuit is much lower, only 1/6 of that in systemic circuit. The pulmonary veins are not completely isolated from the veins of systemic circulation because they anastomose with the bronchial veins draining into vena azigas, The pulmonary vein have no valves. What do you see? Heart, heart. This is aorta, aorta. You see pulmonary vein, pulmonary vein. What do you see? Pulmonary vein. This is pulmonary branches, pulmonary artery. This is vein, vein, pulmonary. This is artery, pulmonary artery. Artery, vein. This is lung, lung. What do you see? Pulmonary vein, pulmonary vein. This is right, and pulmonary vein left. This is pulmonary artery. This is right pulmonary artery. This is vein, pulmonary, pulmonary artery. This is esophagus. This is trachea, a lung, diaphragm. Next question, the arteries of systemic circulation. The aorta, the main arterial trunk of systemic circulation, carries blood from the left ventricle of the heart. The aorta leaves the heart, arcs superiorly, and then descends. This is ascendance, arch, descendance along the bodies of vertebra, and then descendance along the bodies of the vertebra to the inferior part, abdomen. Along this course, the aorta is divided into following three parts: ascending aorta, pars ascendens aorta, aortic arch, arcus aorta, aortae, arcus aorta, descending aorta, descending pars descendens aorta, descendens, ascendens, arcus, descendens. Pars ascendens aorta begins as marked bulba expansion, bulbus aorta. Within the distension are three sinus of aorta found between wall, the aorta, and the cusps, it's the valves. The branches of ascending aorta are two coronary arteries that supply the wall of the heart. The ascending aorta is approximately 6 centimeters long. Behind the manubrium of the sternum, the ascending aorta is continuous with the arcus aorta, arcus. Arcus aorta, Latin. 3 arteries branch from the aortic arch and run superiorly. The first and largest branch is brachiocephalic trunk, truncus brachiocephalicus, which ascends to the right toward the base of neck, where it divided into the right common carotid artery, arteria communis caroticus dextra, and right subclavian artery, arteria subclavia dextra. The second and third branches of aortic arch are the left common carotid, arteria communis caroticus sinistra, and arteria subclavia sinistra. These three branches of the aorta supply the head and neck, upper limbs, and the superior part of the thoracic wall. What do you see? This is ascendant aorta, this is arcus, arch aorta. This is, you see, this is brachiocephalic trunk. You see arteria caroticum communis sinistra. This is arteria subclavia sinistra. 3 artery. Brachiocephalic trunk, arteria caroticus communis sinistra, and subclavia sinistra arteria. Subclavia. Descending aorta, pars descendens aorta. Continue from aortic arch. The descending aorta runs posterior to the heart and inferiorly on the bodies of the thoracic and lumbar vertebra. To the level of hiatus aorticus, the descending aorta is called thoracic aorta, pars thoracica aorta. Below the hiatus aorticus, when the aorta is already in the abdominal cavity, it's called the abdominal aorta, pars abdominalis aorta. Pars descendens aorta include pars thoracica aorta and pars abdominal aorta, ascending arcus descending part aorta. Descending part aorta divided two parts, pars thoracica aorta, pars abdominal aorta. This is pars thoracica, pars abdominal. On the level with the fourth lumbar vertebra, it gives off 4 large lateral branches. The common iliac arteries, arteria iliaca communis dextra, arteria iliaca communis sinistra. This is bifurcatio aorta, bifurcatio. And then continues into the pelvis as a small thin trunk. This is pelvis. This is arteria sacralis media. Media. This is absent. On the picture is absent. In the picture is absent. This is descending aorta, bifurcatio aorta, and aorta iliaca communis dextra, arteria iliaca communis sinistra. Next question, branches of arch of aorta. You see brachiocephalic trunk. The brachiocephalic trunk about 3-4 centimeters in length is a remnant of embryonic right ventral aorta. It runs obliquely upward and to the right anteriorly of trachea, what you see trachea, where it divides behind and the right sternoclavicular joint into its terminal branches. The right common carotid, at right common carotid and right subclavian arteries. This brachiocephalic trunk divided 2 branches, right common carotid and right subclavian arteria, arteria subclavicularis. The common carotid arteria, arteria carotis communis, arteria carotis communis, what you see. The common carotid artery are located in the anterior triangle trigonum caroticum. You see trigonum caroticum, just deep to the sternocleidomastoid, and relatively this infrahyoid muscle. These vessels are more vulnerable than most other arteries in the body because their relatively superficial location makes them vulnerable to slashing wounds. At the superior border of the larynx, the level of Adam apple, each common carotid ends by dividing into external and internal carotid artery. 2 external and internal. Arteria carotid communis divided to external caroticus, arteria caroticus external and arteria caroticus interna. What you see, this is right arteria caroticum communis, dextra divided two branches, the arteria caroticus externa, and arteria caroticus interna. What you see on the surface of body or at the surface of neck, what you see, external carotid artery. This is pulsar point. This is, you see, what laryngeal prominence. This is site or where arteria common. Dexter divided two branches. An external carotid artery. This is external jugular vein. This is caroticus. What an external carotid artery. Carotid artery. What you see? Artery. The external carotid artery supplies blood to the external part of head and the neck. From its point of origin, the external carotid artery runs upward. The branches of external carotid arteries are divided into three groups: anterior, middle, and posterior group. The anterior group include the superior thyroid artery, arteria thyroideo superior, supplies the thyroid gland and larynx. Next, the artery, the lingual artery, arteria lingualis, the tongue. This supplies the tongue. In next, the fascial artery, arteria facialis, the supply skin and muscles of anterior face. What you see, this external carotid artery. This is anterior group. Note you see fascial, what artery? Arteria lingualis, arteria thyroidea superior, anterior group, and you see arteria facialis, arteria facialis, anterior group. Posterior group, the occipital artery, arteria occipitalis. What you see? Arteria occipitalis supplies the posterior part of scalp. Next, the posterior auricular artery, the region around ear. And next, sternocleidomastoid artery, arteria sternocleidomastoidea. This is together forms posterior group. Occipital artery, posterior auricular artery, and sternocleidomastoid artery. Posterior group. Next, middle group. The ascending pharyngeal artery, this is absent. Next, the superior temporal artery, temporalis. This is temporalis artery, temporal artery. What you see, temporal artery. Arteria temporalis superior. And maxillary artery. Arteria maxillaris. What you see, arteria maxillaris. Maxillaris. The teeth and cheek, nasal cavity and muscles or mastification. This is artery, maxillary artery. Internal carotid artery, arteria carotis interna, dextra et sinistra. Supply the orbit and most of the cerebrum. Each internal carotid artery ascendant through the superior neck, directly lateral to the pharynx and enter the skull through the carotid canal in the temporal bone, pyramids, temporal bone. From there, it runs medially through the petrous region of the temporal bone, runs forward along the body of the sphenoid bone, and bends superiorly to enter the sella turcica, just posterior to the optic canal. This is just posterior to the optic canal. Here it gives off ophthalmic artery to the ear and orbit and divides into anterior and middle artery, cerebral arteries, anterior cerebral and middle cerebral arteries. The internal carotid arteries has next part: pars cervicalis, pars petrosa, pars cavernosa, pars cerebralis. Pars cervicalis, pars petrosa, pars cavernosa и pars cerebralis. This is arteria carotis interna. Arteria carotis interna. This is это common. Arteria communis, carotis communis externa. External carotid artery, internal carotid artery. You see, this is arteria caroticus communis. Next, external carotid artery, internal carotid artery. What you see, cervical, petrosi. This is next. This is cerebrum. What you see, this is это pad cavernosus, pars cavernosus. Это arteria communis interna. Right. This is external caroticus, external. Each anterior cerebral artery anastomoses with its partner on the upper side through a short anterior communicus communicating artery, arteria communicans anterior, and supply the medial and superior surface of frontal and parietal lobes of brain. Each middle cerebral artery, arteria cerebri media, runs through the lateral fissure of a cerebral hemisphere and supply the lateral part of temporal and parietal lobes. The posterior the posterior communicating artery, what from internal carotid artery, you see, posterior communicated artery branches off from arteria carotis interna on a short length of the latter after it gives off orbital artery. It then passes back and drain into cerebri posterior from arteria vertebralis. Together, the anterior and middle cerebral arteries supply over 18% of the cerebrum. The rest of the cerebrum is supplied by posterior cerebral artery. This is branches of posterior cerebral artery. And you see occipital lobe, temporal lobe, and other. In the subarachnoid space are communicants, arteria communicants, beginning segment of artery cerebri anterioris, arteria communicans posterior, and arteria cerebri posterior joined to form a closed arterial circle, circulus anteriosus cerebri, Willis circle. Circulus anteriosus cerebri, Willis circle. This is anterior communicated artery, anterior cerebral artery, and posterior communicated artery, and cerebri posterior forms circulus anteriosus cerebri. Circulus anteriosus cerebri. Subclavian artery. What you see, subclavian artery? The left subclavian artery and right subclavian artery. Left subclavian artery belong to group of arterial branches directly off the aortic arch. The artery on the right is a branch of truncus brachiocephalicus. The right subclavian artery is slightly short than left subclavian. The artery forms a convex arch covering around the cupola of the pleura. It leaves of the thoracic cavity through the aperture. What you see, aperture. Superior approaches the clavicula, and first the sulcus of artery subclavian of the first rib, and bend over it. Here the subclavian artery may be compressed to stop the flow of blood to first rib behind, the tuberculum musculus scalenum. Musculus scalenium. This is anterior, median, and posterior musculus scalenos. What you see subclavian artery. Subclavian artery the artery proceed through the, into the axillary fossa, fossa there, beginning with the external edge of the first rib. It has been given the name arteria axillaris. Along the way, the subclavian artery, together with the brachial plexus nervus, passes through the spadum interscaleneus. Those three segments can be distinguished in artery. The first, from the beginning of the artery to the entrance into the spadum interscaleneum. The second, in the spadum interscaleneum. And third, from its exit to the transition into axillaris. This is subclavian. This is arteria caroticus communis. This is truncus brachiocephalica, arteria subclavia. This is axillaris arteria. And you see, this is subclavian artery, common carotid artery. This is subclavian artery, the first rib. This is axillary artery. What you see, this is three branches. This is artery vertebralis, thyrocervicalis trunk, and costocervicalis trunk, and the internal thoracic artery. The branches of first segment of the subclavian artery up to its entry into the spadum interscaleneus. First artery, the vertebral artery, arteria vertebralis. The first branches deflect upward into the internal interval between musculus scaleneus anterior and musculus longus colli, passes into the foramen transversarium of the 16th cervical vertebra and rise through the opening in transverse processes of the cervical vertebra to the membrane atlanto-occipitalis. Atlanto-occipitalis posterior, which it perforates to the cranial cavity through the foramen magnum of the occipital bone. Within the skull, vertebral artery from both sides pass toward the medium line and form a single unpaired artery, arteria basilaris, near the posterior edge of pons. This is pons. Along the way, this artery gives off small branches to the muscles, the spinal cord and dura mater of the posterior cranial fossa, as well as the large branches, arteria spinalis anterior, arteria spinalis posterior, arteria cerebelli inferior posterior. Cerebelli inferior posterior. This is artery vertebra. Basilar artery, arteria basilaris. ascending along the ventral midline of brain stem, sending branches to the cerebellum, pons, and in at the body of the pons and midbrain, it divided into a pair posterior cerebral arteries, which supply the occipital lobe plus and inferior and medial part of temporal lobes of cerebral hemisphere. Basilar, arteria basilaris, arteria vertebralis, connect and form arteria basilaris. Arteria basilaris divided two artery, posterior arteria cerebellaris posterior. Next branches of subclavian artery. It is truncus thyrocervicalis. Truncus thyrocervicalis branches upward from artery subclavia at the medial margin of musculus scalenus anterior. The trunk runs for a distance of 4 mm, then divided into following branches: thyroidea inferior, arteria thyroidea inferior, arteria suprascapularis, and arteria transversa cervicis. This is truncus thyrocervicalis, arteria vertebralis, truncus thyrocervicalis, truncus costocervicalis, arteria thoracica interna. What you see, truncus thyrocervicalis, thyroidea inferior, more than you see, thyroidea inferior, arteria suprascapularis, arteria suprascapularis, and arteria transversa cervicis. Arteria cervicis. 3 artery. 3. This is truncus thyrocervicalis. Next, internal, arteria thoracica interna. What you see? Branches from the subclavia artery superiorly, then descendants just lateral to the sternum, what you see sternum, and just deep to the costal cartilage. Anterior intercostal arteria intercostalis anterior branches of a regular interval and runs horizontally to supply the ribs and the structure in the intercostal space. The internal thoracic artery also sends branches superficially to supply the skin and mammary gland. And inferiorly at the costal margin, where it divides into branch to the anterior abdominal wall and branch to the anterior part of the diaphragm. This is, you see, arteria thoracica interna. What you see, truncus brachiocephalica, what you see, arteria thoracica interna, what you see. This is truncus thyrocervicalis. This is arteria vertebralis. What do you see pictures? When arteria thoracica interna reaches the lower edge of seventh rib cartilage, it divided into two terminal branches, end branches. Arteria muscula phrenica with 11, and arteria epigastrica superior, 12, which anastomoses with arteria epigastrica inferior from arteria iliaca externa. Arteria thoracica interna gives off branches to nearest anatomical formation to the connective tissue of arteria mediastinum, thymus, lower end of the trachea and the bronchi to 6 upper intercostal space and mammary gland, the diaphragm, the pleura, and pericardium, and sternal. There's many branches. Arteria thoracica interna forms many branches. And branches of the second segment of subclavian artery. The costocervical trunk, what you see? Truncus costocervicalis, branches to the spadum interscalenium and passes back and up to the neck of the first rib, where is divided into two branches. 4. This is deep cervical artery, arteria cervical profunda, which penetrates the posterior muscles of the neck and gives small branches in canalis vertebralis to spinal cord. Next branch, what you see? You see 5. Arteria intercostalis suprema, which branches into first and second intercostal spaces. Arteria intercostalis anterior, what you see? Dorsal branches, 7, and ramus spinalis. You see arteria intercostalis anterior. This is connect anastomosis with arteria thoracica interna. Student, thank you for attention. Goodbye. Lecture is finished.